Welcome everyone to the BIPOC Perioperative Leaders to Know 2021 edition. My name is Carissa Brewster. I'm the writer for Women Partners, and our guest today is DeAndre Delsol. And in a moment, we're going to jump into questions, but to begin, will you introduce yourself, your position, and the facility that you're working at currently?
Like you said, my name is DeAndre Delsol. I actually am a traveling sterile processing leader. So I work as a consultant, as a director, sometimes an interim manager, and even as an educator. So the name of the place that I'll give, Chike Healthcare Partners, is a school that I started for sterile processing technicians.
Oh, excellent. Nice. So my first question is what initially drew you into the medical field?
Yes, just a passion to help people. For me, I got into the professional field very early in my life. So when I was 19, I started working in a bank. I was promoted to a regional sales supervisor, so it was like this huge job. And I've made a lot of money very early in my career. But I remember my largest check I ever got, I just kind of felt empty. I was like, is this it? Like, you just get the check, you just get the money. But when I switch over to healthcare, it's not just, you make good money while you're in healthcare, but at the same time, there's a rewarding aspect because it's the patient care. And so that's what helped me stay in healthcare, is just to really advocate for patients.
Mm-hmm. And what drew you to SPD?
SPD, during that transition. So when I left like finance and banking, it was right around the recession. So that's when I went back to finish my undergraduate degree. And I literally walked around the school and I was like, I need a real job because I couldn't go back to the college jobs because I was used to making real money. So I found SPD. It was something I was able to finish in a semester. And I thought that I was only gonna be there for, until I graduated college. But I developed that passion for it. And I realized my skill set can offer a lot to the industry. So I decided to stay, and I've been building my career in SPD and in Periop.
Yeah, that's kind of cool because I feel like SPD gets kind of ignored sometimes. Is that how you feel too?
It definitely does. There's been more of a focus on SPD now. Like Joint Commission is more focused on it. A lot of Periop leaders they're starting to invest more into the department, which is good. And for me, I just made the decision earlier this year. Next year, I'm going to take off a year, do an accelerated nursing program, so that I can, grow in Periop and do more to help patient care.
Okay, what's the name of that program again?
So it's at University of North Florida.
Mm-hmm.
And it's an accelerated nursing program. So it's like 14, 15 months for a BSN. Yeah.
Oh.
And then I want to use that so I can switch over to the other side of healthcare and, help both sides.
Oh, excellent.
Healthcare, not healthcare.
Yeah. So my next question is, have you experienced or witnessed any discrimination throughout your career at all?
Definitely, unfortunately. But I definitely have, and I've seen it, and in multiple industries, not just in healthcare. But I think a lot of it comes from the biases that people have, and not enough training and education, and enough leaders advocating that it's unacceptable. It's not allowed. And so, yeah, I've definitely experienced it. I had to learn how to navigate it. Actually, for my grad school, my capstone was creating a course that prepares Black and people of color students how to deal with discrimination in the workplace, because they learn the same things that other people learn, but they're not necessarily prepared for the real world, what they have to face when they feel that. So
yeah. Is there any experience that had the biggest impact on you that you can talk about without naming names or locations?
let me see the biggest experience. I would say I was at one hospital where I was doing a lot for them. Like they were very far behind in their departments and helped turn a lot of things around. And, they're thriving now. It's going really good. And one thing is I've noticed they treated, say their workers from the dominant class different than their minority workers, their Hispanic workers, their Black workers. And so I was very big on treating everybody fairly. But it did become a little of a conflict when that it was almost that the extra privilege I didn't give almost felt like discrimination, but I was like, I guess you haven't had a leader where you're being treated equally. You know what I mean? Like if you get it, they get it as well, or if you don't get it, they don't get it either. And so that was really tough for them, and it was hard to see that leadership still wanted to stand behind that model, because I think that a lot of people haven't seen another model, how to do it the right way, or just it's okay to, well, I'll put it like this. Certain things they were holding on to was cultural, like, well, this is the culture of our department. But you got to understand that culture that was built pre-diversity may be oppressive towards those who are not, those who are not the same as when you built your culture. So you have to be willing to elevate your culture or change your culture. So it's all inclusive for everybody.
Yeah, to not do business as usual where everything's super hierarchical and you treat certain people a certain way because they're, say, a surgeon, and then other people a certain way because they're lower on the totem pole.
Yeah, exactly.
Yeah.
Because it's like in culture, you love culture. Even just speaking for the Black community, there are certain things that even culturally they can say soul food is kind of cultural for us, but then it can lead to some of the sicknesses that we have. So it's like you have to be able to elevate from the culture if the culture is not uplifting to, who you are or where you're going. So the same in healthcare, it's like you built this culture, which was great for you when, say, it was only a certain type of person in there. But when you start to get more diverse and get other talent, they don't feel the same way about it. So you have to be willing to adapt, or elevate your culture, towards more inclusive to everyone.
Yeah. Yeah. What are your concerns, or do you have any concerns about diversity, lack of diversity and inclusion in the operating room, especially like at the upper levels with the directors and leaders, administration, C-suite, things like that?
Yeah, I definitely want to see more leaders, a more diverse set of leaders. That's something that which is why I'm working on getting all the credentials I need and trying to grow in that, so that I feel that it's beneficial when more people are at the table during the decision-making time to make sure that, we're getting the best outcomes that we want. So traveling around, like I've been all over the US in different hospitals, I've seen very few, Blacks and other people of color just in upper leadership. I've seen a lot as technicians and all of that, but when again into the positions of power and all of that, seen very, very few. And then something that was concerning for me is the ones where I did see that they're in leadership. We won't name any hospitals, but like this one hospital, the manager, she was a Black woman, and I believe the environmental service manager was a Black woman as well. And out of all the managers in the entire hospital, they were the only two that didn't get bonus. And it was like, it was just difficult. It's like, you guys don't see that. This is not, if you get bonus as a manager, everyone's all managers. Why is the only two not getting bonus, only two that invited to certain, awards or benefits, things that they did. So I think that we have to be very cautious of that and not think that it's something small, but it's like, what does that do to the morale of the team? The morale, just even your advancement with the hospital is that, you see how they treat you differently and just, in a structure of what they're doing. Mm-hmm.
Do you, you mentioned how you're trying to up your game with your credentialing and your education stuff. Do you think that's one piece to more people getting up the ladder, or just seeing a path? Because maybe some people don't even know, like, oh, this is something I can do.
Yeah, I think that it depends on the individual and just their drive, their passion, their values. For me, per se, like that, what I did for my capstone, one things I wrote in the advice for advancing is, and now this is what I do, everybody may not do this, but when I'm applying at a hospital, I'll look to see if their diversity team is already, or if their leadership team is already diverse. Yeah. And if it's not, then I'm not really interested in working for that hospital, because now this is something different about me. A lot of people get excited about, oh, we just hired the first Black ... It's like 2021. There's tons of talented African Americans, Black people out there. So if I'm just becoming the first, I don't want to be the first. I want to be somewhere where you've seen Black talent before, you've promoted, you gave raises, you lifted them up. I would have been number 47 in baseball breaking barriers because it's like I'm not taking all the, you know what I mean?
It's
it's
stressful to be the first.
You know what I mean? Like it's not it shouldn't be surprising to see a Black person of talent. And so I've done that a lot in my life. Like even in school, high school, I was on the swim team. I was a diver. Like out of everybody completely, I didn't see any other Black divers, you know. And I was on the volleyball team. So it's been a lot of spaces where it was just me. But from my family and from friends, I know so many talented and successful Black people that it's like, I shouldn't be the first in your organization, you know, like you should. There's so much talent out there. Why am I, you know, the one that just made it through? I think there's something missing.
You bring up a really good point, because you're right. It's 2021, and it's like your generation is getting to the point where you don't want to be the first. And if companies aren't already on that diversity and inclusion piece, you're moving on to a company that has it. So they're losing talent from not addressing it.
Yeah. Mm-hmm.
Yeah. Mm-hmm. Yep. What advice, and you might have already said some things, but what advice do you have for someone a BIPOC individual who wants to move up the ladder of perioperative leadership?
I say you have to know yourself, know thyself, that phrase, and just be authentic, because that's what I've done. I mean, as you see, like I don't consider myself a traditional, a traditional leader that you see all the time. But at the same time, my results aren't traditional either. I've broken barriers that, like, I've had CMOs say they haven't been able to figure this out for 20 years. So I bring myself to the table. And I think that sometimes people, they think about, what do I have to become so I can fit? And sometimes when you change yourself to become that cookie cutter version of leadership or someone else, you take away the very special things about yourself that will make you shine or that will make you soar, So I think that it's best to know who you are and know what your strengths are, be the best version of that and bring it to the table. And if you're in an environment where they don't appreciate it or don't want it, don't change yourself, change the environment.
Mm-hmm. Yeah.
Because that's what, we study the books and we like the movies of the greats, great leaders. They, they stuck to who they were, and they kept going forward. Like Steve Jobs was who he was when he was with Apple. He was who he was when he left Apple, and they saw that they wanted to bring him back because they weren't as good as they were without him. So bring yourself to the table, and that's when people learn how to appreciate you and your authenticity.
Yeah, that's a great point, because if you put yourself out there and present yourself as, these are my strengths, and you get hired somewhere, you want to be able to do what they hired you to do. Right.
And I feel like I'm I can be an example for others. I was a director at Malcolm X College before, and I remember the dean. I was a director of medical programs, so sterile processing and some other program. The dean of the school, I remember he said, well, we wouldn't let any students, and he's a Black man as well. We wouldn't let any students in the program that had locks because hospitals won't hire a person with locks. And I'm like, I have locks and I'm the director here, And so that's why you have to be yourself, because it's like you're showing them a different appearance, a different point of view. Like, I go consult, I do this, that, and the other. And, I may not look what you think is traditional, but very professional. I get the job done. And so sometimes when people see that, they're like, oh, our director had lots. So why wouldn't we let the students in the program with lots? He could be just as great or even greater, So that's where the authenticity parts come from.
Yeah. So as you know, we're dealing with the surge from COVID due to the Delta variant, and there's a lot of vaccine hesitancy throughout the wider community, but also within the Black community specifically. What are your thoughts and opinions on how to encourage more people to get vaccinated, and how to encourage more people to seek out like the correct and verifiable information about the vaccine?
I think as healthcare providers, we have to be honest, transparent. I feel like one of the problems with people getting a vaccine is that the information doesn't feel authentic and it doesn't feel transparent. And I think people feel talked to or kind of talked down to. It's kind of like they don't understand because, for instance, with history, everybody knows about Tuskegee, but there's things where the healthcare system has not done great things, especially for Black people. And so there's a trust issue there. There was an article a few years ago, and something I talked about people in healthcare, it was where Black women were going into the hospital with, chest problems, heart attack symptoms, and they weren't following protocol because they had a bias that Black women complain. And so you have people dying because you're not doing what you need to do. So if that stuff is out there, how do you think people are going to trust what you're saying, that they're going to trust the information that you're giving them? And so I think that they have to be aware of that, not just, saying in passing like, oh yeah, Tuskegee happened, that was a long time ago, but really understanding it, really studying it. Like there's a whole book, Medical Apartheid. There's a lot that has happened with healthcare in Black people. So it's just really understanding that as a healthcare professional and saying, okay, well, let me give you all the information. Let me not just tell you this is why you should do it, but let me help you become an informed patient. These are your risks, by getting it. Yes, it does have risks. These are your risks by not getting it. You have to make the best decision and trust that people would do that. But when things are kind of seems forced upon them, like vax stepping up and all of that stuff, it makes it just like, it comes across as a joke. Like it doesn't come across as serious or as credible as it should, because it's like you're kind of talking to me as if I'm like a child and you don't, you're not really telling me the information that I need, or, or is your agenda to help me personally? And I think that we need that. And I think that they also can get into the community healthcare worker field, where you work with people who are already connected to the community, where some people are like, okay, if they tell us, we would, because they have our best interest in mind. So really help grow that field and start working with those people who are connected with the community, who will be honest. They'll tell you if you're wrong, or they'll tell you, if it's okay, and they can take that to their community. I think that would help as well.
Yeah, I think also just taking their concerns seriously.
Yeah.
To not looking down on somebody because they have what you may perceive as a silly notion about something, but you don't have to agree with someone to take what they're saying seriously.
Yeah. Because when I got vaccinated, it was like, you read the some of the side effects that could happen. It was talking about, heart palpitation, like this, like my heart is right now. So I want to stay fine. Like I would hate to get something and cause a different problem. So people's concerns are legitimate, but you just, you help them weigh the cost benefit analysis when you do it. Just help them understand and trust their decision,
Yeah. So my last question is, do you have a favorite or current book that has inspired you? You did mention Medical Apartheid.
Yes.
So who's the author on that?
Harriet Washington. That and the other book is Good to Great.
Good to Great.
Yes. So it's talking about the main point there is that good is the enemy of great. And it's something that I use when I go into departments to really help them, because sometimes the reason good is the enemy of great, because some people are satisfied with good, so they never become amazing, they never become excellent. And so and it talks about how you build great teams, how you build winning teams. And one quote that I really like is, it says that people are not your most valuable asset, but the right people are the most valuable asset. And I think I've seen in places where someone could have been friends with leadership or something like that, but they're just really not a good fit on the team. Not saying they're not a good fit in a hospital, they just may be in the wrong position. But to really have a high performing team, you have to put the right people in the right seats in the right spots with the right amount of power so they can do what they need to do. And when you do that, you have people not only they love what they do because they're good at what they do, and they can really perform, and that's how you elevate your teams to greatness.
Good to Great and Medical Apartheid. Yep.
Yes.
Awesome. Thank you so much for agreeing to talk with us. This is my third interview, and it's been like a pleasure speaking with healthcare workers and leaders. I mean, it's so tough right now. And I just want to thank you guys for hanging in there, and hopefully we'll be getting out of this.
Thank you.